Hello, everyone. This is Brian Hartman with Emerge. Now, grab a float because we're diving into the deep end of the side effects of Zepbound, Wegovy, and all the other GLP-1 medications. This is going to be a long video, so get comfortable. If you've been paying attention to the weight loss arena, you've noticed massive changes in the last few years. It seems like everyone is taking something to lose weight, often without a good understanding of what they are putting into their bodies. It's like people feel like losing 20% of their entire body weight is no big deal and aren't overly concerned about what might go wrong in the process. Hence, this video. Part 3 of our Zepbound and GLP-1 medication series, Side Effects. Don't you hate those TV commercials where a drug company announces a new medication that no one can pronounce by showing happy people frolicking on the screen? And then a voiceover tells us all of the horrible side effects we might experience along the way. This video is a bit like that voiceover, but I'll try to put everything into context and give percentages when I can to indicate how frequently people experience these. Now understand this is not an exhaustive list. If you're taking a medication and you're concerned you may be having side effects, speak with your prescriber about them. I'm going to break these up into two categories. First, we'll talk about legitimate side effects of the medication, meaning what happens from taking the med and its direct effects on your body. Once we've covered those, we'll talk about some of the expected consequences of weight loss, not necessarily side effects of the medication, but side effects of the results of the medication. It's important we understand these because to get the most success out of these medications, you need to know how to handle the side effects. GI side effects are the number one reason people stop this medication, other than due to access issues due to cost or availability. So, jumping right in. Number 1, nausea. Probably the number one most common side effect patients report while on GLP-1 medications, up to 15 to 30% of the patients. It's that feeling in the middle of your abdomen like you swallowed a live hamster and it's trying to find its way out. GLP-1 medications such as Zepbound and Wegovy act on the stomach to slow its emptying. Now, this can cause nausea directly or indirectly by leading you to retain food products in your stomach longer than normal. The medications also affect your central nervous system and can cause a centrally mediated nausea. If you eat a large meal or drink a lot of water, you're going to be more at risk of feeling this. If you feel a lot of nausea, try to reduce your meal size and eliminate processed carbs. Another trick is to save your stomach volume for food at mealtime instead of fluids, meaning get all your fluids in at least half an hour before mealtime or an hour after your meal. Anything to avoid distending your stomach more than necessary. Now, this side effect should improve in time. As long as you're able to get adequate fluids and nutrition, it's likely okay to continue the same dose. If you're vomiting or unable to take in adequate nutrition, then delay your next dose until you're feeling better. Now, worst case, we can try medications that can increase motility or the emptying of your stomach, such as Reglan. There's other medicines like Zofran that we can try as well. Side effect number 2, indigestion. Another common side effect of GLP-1 medications is indigestion, heartburn, dyspepsia. There's lots of words for it. Many people have baseline acid reflux from a variety of causes. Maybe you have a hiatal hernia. Maybe your lower esophageal sphincter doesn't function properly. Maybe you have obstructive sleep apnea and reflux acid into your esophagus when you try to suck air in past an obstructed upper airway. Now, this can be treated with antacid medications such as proton pump inhibitors, Prilosec, Nexium, Protonix, or Pepcid. Avoiding large meals or fluid intake should help reduce the stomach distension and the pressure inside to reflux acid back up into the esophagus. Now, here's a key point. If you're experiencing bad indigestion, avoid the carbonated beverages. Imagine that can of Diet Coke bubbling around inside your stomach, trying to rise up and cause heartburn. Next side effect, sulfur burbs. I'll be honest, I've never been a fan of this term. There's just something graphic about it. I don't know. But it's used all the time by patients, so we might as well use it. Hydrogen sulfide is the gas that gives us this extremely unpleasant taste and smell. It's produced in the stomach by bacteria in response to certain foods when combined with the acids. With GLP medications, the food hangs around longer and is more likely to produce this unpleasant side effect. Dairy is known to make this much worse, as is eating eggs. So if you're experiencing sulfur burbs, avoid dairy. You can try a PPI to reduce the acid that's active in your stomach. Also, Pepto-Bismol and Culturel have been able to help some patients in the past. Smaller meal size can also help. I hope you're enjoying this video and are learning something that will help you along your weight loss journey. Please take a moment to like this video and subscribe to our channel. We offer comprehensive medical weight loss through our telehealth company, Emerge. The address is listed above, and we also have a Facebook group you can join to learn more and receive support from others. The links are below in the comments. Next side effect, diarrhea. This is unfortunately reported by up to 10 to 15% of patients on GLP-1 medications. Now, you need to watch out for dehydration or even acute kidney injury if this is profound. You got to push fluids, avoid things that can make it worse, such as sugary beverages, dairy, laxative, artificial sweeteners like sorbitol, xylitol. Do not escalate your dose until you're feeling better. You may need to even reduce your dose if it returns when you take the next injection. If it's severe, you can take Imodium to slow it down, but talk to your prescriber if you're on metformin, as this may be a side effect of this medication as well. Constipation. This is another common side effect, and one that can be quite uncomfortable. Many patients are concerned they have a true obstruction, but that's pretty unusual. If you're still passing gas, it's unlikely you have an obstruction. Constipation is best treated early rather than waiting for it to become severe. The bowel's main purpose is to absorb water from our stool so that we don't have massive volume losses from chronic diarrhea. But as our intestines slow, this means more water is taken from our stool and it becomes harder and more difficult to pass. This means we need to ensure we're drinking adequate water and eating fiber, both soluble and insoluble fiber. Recommendations are between 25 to 35 grams of fiber per day at baseline. Miralax can help as well as magnesium supplements. Light activities such as walking can help stimulate the bowels as well. If you're miserable, hold your dose until bowel function returns. Insomnia or anxiety. This is a reported symptom by some patients, but certainly not most. Some patients note a decreased need for sleep without feeling tired. Others report true insomnia with the resultant fatigue. Now, melatonin or diphenhydramine can help treat minimal symptoms. Trazodone is a non-addictive sleep medication that can be used for more intense sleep issues. I'm not a fan of taking daily sedative hypnotics such as Ambien, but they can be used in certain circumstances. There was a thought that patients in ketosis may experience insomnia, and GLP-1s may allow ketosis easier due to the decreased consumption of food. Another option is to eat some complex carbs at bedtime to see if that helps your symptoms. GLP-1 medications can also cause an increased heart rate, and that may feel like anxiety. Speak with your prescriber if you're noticing significant issues. Abdominal pain. This is a very broad complaint. This could be something as benign as gas pain or constipation to something much worse like gallstones, pancreatitis, an ulcer, bowel obstruction. Rapid weight loss can exacerbate gallbladder symptoms, and a reduced stomach emptying can worsen the risk of NSAID-induced peptic ulcers. So if your symptoms are worsening or severe, do not take additional dose and seek an in-person evaluation of your symptoms. Now let's move into the negative side effects of weight loss in general, not specific to GLP-1s, but just weight loss in general. First off, hair loss. Now here's a nice Latin term for you, telogen effluvium. This is a term for diffuse hair loss that's usually temporary and it's widespread. Usually happens about 3 months after triggering an event, like starting a weight loss medication. It usually resolves after 6 months, but be sure you're eating a balanced diet with adequate protein and a multivitamin supplement. This should be temporary and does not require medication. Feeling cold. This is incredibly common and almost a badge of honor for significant weight loss. It is that common. Now, there are many factors that affect it, but a few should be investigated. Make sure you don't have nutritional or hormonal imbalances, such as an underactive thyroid or iron deficiency anemia. Losing significant adipose tissue reduces our insulation, makes us more sensitive to changes in temperature. Also, it's well documented that significant weight loss reduces our metabolism, which will reduce heat generation. Sarcopenia. This is the medical term for the loss of muscle mass, usually seen in the natural process of aging, but we see it in weight loss in patients who don't get adequate protein intake or who don't do resistance training. Typical weight loss in studies on these GLP medications are 75% adipose tissue and 25% muscle tissue. As we age, it's more difficult to add muscle. It's much easier to maintain existing muscle mass than it is to gain muscle as you age. So make sure you're eating at least 0.7 to 1 gram per pound of goal weight in protein per day. And make sure you're doing at least some light resistance training 3 days a week. Lean muscle is more metabolically active than adipose tissue, and we want to keep as much muscle as we can. Now for some good news. Not all side effects are negative. There are many positive side effects of weight loss. This video is longer than average, so I'll touch on them briefly. Decreased inflammation. Many patients report improved in autoimmune diseases as well as inflammatory conditions like arthritis. This could be a direct GLP effect or a change in diet or from weight loss. I recently had a patient who forgot to tell me about her degenerative disc disease because since losing significant weight, it hasn't bothered her. Talk about a non-scale victory. Improved non-alcoholic fatty liver disease. Now, non-alcoholic fatty liver disease goes by several names and recently underwent another change, MASLD, metabolic dysfunction associated steatotic liver disease. This is a side effect of increased fatty acids in the liver and resultant inflammatory change leading to fibrosis and scarring. This is now the #1 cause of cirrhosis in the United States. Tirzepatide and semaglutide have been shown to significantly improve this. In fact, Lilly is seeking approval for tirzepatide specifically for the treatment of MASLD, if I can call it that. Improved cardiac outcomes. The SUSTAIN 6 trial showed a significant reduction in cardiac events in patients with type 2 diabetes who took semaglutide. as much as a 20% reduction in heart attack, stroke, and death over 5 years. Reduce alcohol intake. Patients on GLP-1 medications generally report decreased alcohol intake. It's being investigated as a potential treatment for alcohol use disorder. Dr. Jesse Richards published preliminary data showing exciting results in a smaller study. Larger studies are still in the works. And there you have it. That was a whirlwind tour through some of the side effects of GLP-1 medications and significant weight loss. I hope you learned something. Please like this video and subscribe to our channel to be notified when we release the 4th video in the series. It will cover dosing of GLP-1 medications, including how to start, how to escalate, and how to handle maintenance. We'll also cover handling of the medication once it's in your possession, which can ease your mind while traveling. Now, thank you for watching. Now let's get healthy together.